Welcome to my channel Health Hacks. Today we are talking about glimepiride. Glimepiride is an oral medication that doctors prescribe to treat type 2 diabetes. Type 2 diabetes is a condition where the body does not make enough insulin, or the insulin that it makes does not work properly. This can cause high blood sugar levels, hyperglycemia. Glimepiride lowers your blood sugar by increasing the amount of insulin your body produces. Glimepiride belongs to a class of drugs called sulfonylureas. Sulfonylureas work by stimulating the beta cells of the pancreas to release more insulin. They also help the body use insulin more efficiently. Sulfonylureas are one of the oldest classes of drugs for type 2 diabetes, and they are usually used in combination with other medications, such as metformin or insulin. Some recent studies have suggested that glimepiride may have some additional benefits beyond lowering blood sugar, such as reducing inflammation, improving cardiovascular outcomes, and protecting against oxidative stress. Glimepiride is indicated to treat type 2 diabetes mellitus in adults who cannot control their blood sugar levels with diet and exercise alone, and who do not have severe kidney or liver problems. Glimepiride is not for treating type 1 diabetes or diabetic ketoacidosis. Glimepiride may cause some common side effects, such as headache, nausea, dizziness, and weight gain. These side effects are usually mild and may go away with time. However, some side effects may be serious and require medical attention, such as low blood sugar, hypoglycemia, allergic reactions, and blood disorders. Low blood sugar can cause symptoms such as sweating, shakiness, hunger, confusion, blurred vision, and seizures. Allergic reactions can cause symptoms such as hives, difficulty breathing, swelling, and rash. Blood disorders can cause symptoms such as bruising, bleeding, infection, and anemia. The dose of glimepiride depends on the individual's blood sugar levels, response to treatment, and other factors. The usual starting dose is 1 mg once a day, taken with breakfast or the first main meal of the day. The dose may be increased gradually by 1 to 2 mg every 1 to 2 weeks, up to a maximum of 8 mg per day. The dose may be adjusted based on the results of blood sugar tests and the doctor's advice. Glimepiride should be taken regularly and at the same time each day to get the best results. Glimepiride should not be stopped or changed without consulting the doctor. I hope this information is helpful to you. If you have any questions or need more details, please let me know. If you want to know more about the medicine, please follow my channel and visit my page. There you will find more videos, articles, and resources that will help you to manage your condition better. I appreciate your support and feedback. See you in the next video.